Hello, everyone. Good evening, and welcome to yet another episode of ICPA Clinical Series. As you all know, the theme of ICPA Clinical Series is each episode one clinical challenge. We get the best of the best from the experts from their domain of expertise, and they solve one clinical challenge in each episode. And today we have a special guest. He's not only a clinician but also an acclaimed academician, researcher, as well as an entrepreneur. And because he is an entrepreneur in laser dentistry, we call him LASERpreneur. Dr. Chandrashekar Yavagal from Hubballi is an internationally acclaimed clinician, speaker, and a post PhD doctorate in laser biophotonics and laser photodynamic therapy. Soon we will get to hear from him what made him move uh, from being a clinician and researcher into a laserpreneur. Dr. Yavagal was a university topper at BDS and a gold medalist MDS in pediatric dentistry from Rajiv Gandhi University of Health Sciences. He completed his diploma in orthodontics from Orthodontic World Institute, Barcelona. He is also a fellow of International College of Dentists, a fellow of Asia Pacific Laser Institute, a life member of European Medical Laser Association, and a diplomate of the International College of Neuromuscular Orthodontics and Nathology, Italy. He's the director and the head of India's first exclusive department of laser dentistry and photomedicine at the Maratha Mandal Institute of Dental Sciences, Belgaum, with close to 100 publications in national and international peer-reviewed journals. He is presently the chairman scientific at Novolace Education and Training, the vice president of the College for Light Medicine and Laser Therapy Germany, and the director of World Association for Photomodulation Therapy. A lot of laurels and achievements and accomplishments. And most importantly, Dr. Yavagal is the founder of LaserVEDA, Healing and Wellness Solutions. And as you all know, he's a laserpreneur, the creator and the maker of Novolace lasers, which he'll be talking about in today's webinar. So, welcome, Dr. Yavagal. It's a great pleasure and privilege to have you with us. So, the question everybody wants to know, the answer for which everybody wants to know, what made you move from being a clinician, academician to a laserpreneur?
Thank you very much, sir, for that wonderful introduction. One episode, one problem. For me, the biggest challenge today is to face Dr. Rajiv Chitguppy, and I'm somehow mustering courage to do that. I have been your fan for 25 years now, so it's nothing short of a fanboy moment for me. Imagine Shah Rukh Khan coming and interviewing, a small-time side actor. He'll all be nerves, and that's kind of a feeling. Thank you for inviting me here, sir, and pleasure is absolutely mine. To answer your question, I am very much a clinician, a wet-fingered clinician. In fact, I just changed 30 minutes back from my scrubs, so I haven't stopped being a clinician, neither have I stopped being an academician. But yes, 17 plus years that I have spent in this field made me realize that if laser science has to become commonplace in the Indian practice scenario, then we need to produce lasers which are affordable by Indian dentists, which are easily usable by Indian dentists. If we are here to pass on the message that the healing laser science has to reach the masses of this great country, then our dentists have to first accept this technology. They have to afford this technology. Only then the benefits of this technology will reach the citizens of this country. If we keep importing cheap Chinese units, or if we keep importing expensive American or German units, they are not going to solve our problems. So probably a step towards making ourselves Atmanirbhar in the field of laser science is what prompted me to lay my baby steps into this field of entrepreneurship. But I haven't stopped being a clinician, nor have I stopped teaching pediatric dentistry, sir. That's my first love.
Amazing, amazing. And as the name goes, Novolace, Novo is new. So
Yes,
it's
sir.
a
It's a
new
new
thought
star.
process. Yeah.
It's a new
Okay.
star. Yes, sir, exactly. As I will touch upon that particular fact in this presentation, we want to move away from the cliched cutting laser concepts, which a lot of
Okay.
so-called laser pundits also, proclaim a lot or talk a lot about it. There is so much more that a laser device can do. So it's a new thought process. It's a new venture, a new project, a new star on the block. That's why
Amazing.
Novo.
Amazing. Amazing. So We are all excited to hear it from you. So the stage is all yours. The floor is all yours. You can start with your presentation.
Thank you so much, sir. I believe I have 45 minutes, so let me do justice to whatever time
Yes,
has
yes,
been
yes.
given to me.
Take your time. Take your time, please. Thank you. Your slide is visible. You can start.
Thank you, sir. How difficult it is to bid adieu to our old forms of thinking. Well, we have specifically chosen a slightly off track topic today, more of economics than the science. Yes, of course, I'll be touching upon the science of laser dentistry, but I'm here to bust quite a few myths. The first one being laser dentistry is an expensive field. Only rich dentists can afford lasers. Only rich patients can afford such rich dentists. So these are the some of the myths that I'm here to bust. So life has everything in it, but you only see what your perception allows you to see. Let me show you things about laser science from my perspective. Maybe I'll be able to at least inspire a few of you to bid adieu to your old forms of thinking, because if you want to expand your income, you need to expand your understanding. If you keep adding 2 to 2, you will keep getting 4. If you want 6, you have to change something, right? So basically, I was very, very inspired by Robert Kiyosaki, Rich Dad and Poor Dad, and I kept reading about this and what his rich dad taught him, which his biological father could not teach. So, any of you who have not had this opportunity to read the Rich Dad and Poor Dad, you have a poor friend here who is ready to distillize it for you and make it more palatable. Rich dentist versus poor dentist. This doesn't mean that I am rich by any stretch of imagination. I am going to give you tips and tricks to become like Dr. Rajiv Chitgupi, whom I know is definitely very rich, right? So let's see. I want to share how I got into this field, and I want to trace my journey. I'll tell you my story because I know everybody has a story, and mine is nothing great. But yes, I want to tell you what made me venture into lasers and how difficult it was initially, and what has changed with time. So this is my story. This is my adventure. So when I started, this was who I was, and people call this the story of the fourth block to the Forbes. That was the fourth block that where I grew up in, and that was my residence. So I used to be very, very ashamed of calling friends home because there was no home. I mean, the moment it would start, it would end, and invariably my vests would be torn. And this was the time when I had to wear a new vest because my neighbor had got the first camera ever. This was the first time that I was ever facing the camera. I'll not tell you how old I was or when this was, so that I keep that perception in your minds that I'm still very young. Otherwise, I'll have to reveal my age to you, but you can guess I must be around 6 or 7 years of age. So fourth block, things were so difficult, and I had you know the blessings of my parents, and God has been kind, and here I am today. And this has been one unforgettable journey. So if I uh, have to call myself successful by any stretch of imagination, if I'm able to uh, do something worthwhile today, then it's all thanks to this amazing profession, this amazing science. So I've always believed in this, that poverty is not a handicap. Poor mindset definitely is. I come from a very, very small town in Karnataka called Hubli. Dr. Rajiv Chitgupi sir knows this place better than anybody else. So when I ventured into laser dentistry in this small town of Karnataka, people, my great seniors, and some of my own teachers told me that you have gone nuts. You are investing on a technology that's going to ruin your career. You will be left with nothing. This is a story which is 17 years old. So things have changed, and adamant that I was and I am. I kept trying new things. But yes, let me be very honest with you. The first few years were very, very difficult. And I would say, as much as I respect the science, I must say the old school cutting laser knowledge actually failed me. So this is one story that I want to share, so that we are able to make a difference to many people's lives in many different ways. And one way to do that is to become financially free. If we are not financially free, then we will not be able to serve the people who come in contact with us, neither will be we will be able to lead a life of comfort and dignity. So all big journeys begin with small steps. This was Naili. Naili in Latin means the one I love, the one I miss, because I don't know her name. This was that little 40-day-old kid who came to my operatory. I was just about a fresh practitioner. This was the year 2006, if I'm not wrong. And when my receptionist asked this child's mother to fill out her name, she broke into tears, because the last 40 days of her birth, they were simply running from pillar to post. Nobody knew what this growth was. Some oral surgeon told them that this doesn't look good, it has to be excised under anesthesia, and the thing has to be sutured up, and the child has to be again sedated to take those sutures off. This scared the hell out of them. Somebody told them that there is a new jobless pediatric dentist in a small town like Hubballi, why don't you go see him? That's how they came to me. And that's when I thought that I should help this child out. Apart from writing a 100-mark essay question on lasers in pediatric dentistry, my experience in pediatric dentistry related to lasers was a big zero back then. So I had to start this journey slowly but surely, in taking the hard steps. So that's the bare fiber that I'm holding for my very first case. I had to borrow this laser from an ENT specialist in my town for 350 rupees. This is not how it is done. You are not supposed to hold a bare fiber in hand and do it. So I'm sharing my mistakes and my share of foolish adventures that I have done along this journey. God has been kind. This was how the child showed up, and this was what I was able to deliver with my first case. And what happened after this gave me a false sense of an illusion that I my surgical skills were awesome. Nonsense. For 6 7 years after that, I was an expert cutter. I kept cutting everything, kept cutting frenums, kept doing mucosal excisions, and got myself that feeling of being a very accomplished pediatric surgeon. And I kept doing that because, according to me, that was laser dentistry, laser surgery. And unfortunately, in 2023, a lot of the so-called laser pundits still think that that is laser dentistry. That's the sad part of the story, but this is routine now. I love children. I could have walked into any specialty, but the fact that I chose pediatric dentistry is for a simple reason, that I love children. I can't see them in pain. So my every pediatric case starts and ends with lasers, because I want to see them smiling. So that's who I am, and that's my pediatric clinic in at YHF Laser Institute. I have all my favorite toys there. My favorite toys there, including an Erbium YAG 2940. I have an ND YAG. I had a carbon dioxide, not anymore, and a few 3 or 4 different diodes of different wavelengths. So this is where I play, and this is what I do. Now let's do some math. It looks all very nice and rosy today, but it was not how it was initially. So let's do some math, and let me share with you how this cutting laser school initially failed me. This was my first loan ever on a laser machine. It was a German unit costing 4 lakhs, 4 lakh plus. I had to take a loan for 4 lakhs, to be very honest. It was close to 5 lakh rupees back then. And my monthly EMI came to 13,478 rupees. 13,478 rupees today looks like a very small amount. But back then, for me, from a small town, 2005, 2006, 17, 18-year-old story, reaching 13,478 rupees every month, close to 14K, was a big deal for me, to be very honest. So my mind was constantly looking for more frenums to cut. My mind was constantly looking at what lesion can I cut, so that I charge 2 or 3 thousand from it. Unless I do one cutting job every week, I'll not be able to bloody pay my EMI that particular month. So this was the constant thought process which kept me glued to cutting for the 6 7 years that I started my laser journey. What happened next? Well, let me ask you this. How much revenue did you guys generate last month? If you generated 50,000, but you wanted to generate 2 lakhs, then you please deduct that 50,000 from the 2 lakh that you wanted to generate. So 1,50,000 rupees is the price that you are paying for not being as skilled as possible as soon as possible. And that's the reason why ASAP, you see the letter S has been replaced by a dollar there. As skilled as possible, as soon as possible. I kept telling myself that I was very skilled, but I was suffering because of limited knowledge. In fact, it's so sad that 2009-10, when my own dad was suffering from mucositis induced by chemotherapy that he was taking for his CA prostate, like a doting son, I used to apply Kenacort cream on his mucosa. I had a damn laser in my cabinet, but I had no freaking clue that I could use it in any other form other than cutting to help my own dad out. Today I travel the world talking big things about what lasers can do, but I was a miserable son back then, in the sense that I failed in taking care of my own father. So the least that I can do is popularize this science, that many fathers who are suffering from different kinds of cancers at least get the right help at the right moment. And this was one thought process which constantly kept on edging me on to devise something which is affordable. Just like, I draw inspiration from Ratan Tata. He was the first guy who made every Indian realize that they could drive a car of their own by introducing the nano for a lakh of rupees. It was nothing great, but yes, it was for the first time that somebody has shown a dream to the majority of the Indian families that they could also afford a car. Some similar thought process got into my mind when I realized that if we have to get into the rich dentist club, then we need to get our understanding of the color spectrum right. I'll come to the wavelength and the color spectrum of the lasers later, but since this topic, the organizers also wanted me to focus on the economic parts of it, because a lot of people think that dentistry is a sinking ship. There is a lot of negativity surrounding this whole profession. People think that dentists have got no job to do and they are like, they are going to their worst. No, it's not so. If you were at the IDS, you would have believed what I have just trying to put it across in terms of words. You can make $3,000 from one customer, or you can make $3,000 from 1,000 customers by charging $3 each. So what is this math about? Right? So you can either be on the yellow part of the spectrum or can be on the red part of the spectrum, right? Or you can be anywhere in between. You can be on the green or you can be on the blue. Now, what exactly am I talking about? See, when I talk about the laser value ladder, I keep the laser cutting part at the lowermost rung of the ladder, because there are far more greater things that can be accomplished by using the same device that you have in your hand, provided you have chosen the right wavelength. I'll come to that a little later. So, what are these other greater things? You could use it for laser assisted endo perio, the same cliched things. But would you believe me if I tell you that you could yourself call or be a laser oncologist or a neurologist very soon, just by having a basic PBM device or a therapy laser device? Sounds like mumbo jumbo, is it? Yeah. Give me some time. Maybe I can change your perception in the next 20 minutes or so. Ladies and gentlemen, you get paid for the problems you solve. When I showed you the color spectrum of $3,000 from one patient versus $3 from 1,000 patients, this is what I meant. We are so obsessed with our mechanical concepts: sharp line angles, round point angles, flat pulpal floor. We start our journey with an enamel hatchet. We learn amalgam based concepts which we are never going to use in our restorative practice. We think looking at the teeth and looking at the gums around them, probably trying to save a tooth by doing a root canal and placing a zirconia over it and doing a little bit of cutting here and there, calling it a smile designing, is dentistry. Unfortunately, it is not. Sorry to disappoint you. That's only a minuscule part of what we can accomplish as head and neck biologists, as people who are so trained, so very well trained with the anatomy and physiology of the head and neck. How on earth would you manage this? You get paid for the kind of problems you solve. You solve bigger problems, you get paid more. You solve the same mundane problems as what your neighbor is solving, be happy with what you're getting. As simple as that. I still remember this case. I was traveling to Trivandrum for a university convocation. I was the chief guest there and I was supposed to reach there. And when I landed at Trivandrum, Dr. Dikshit Raj, a very good friend of mine, showed me this case. And I had no freaking clue why I was carrying my laser with me that day. I had no freaking clue. Look at her. Show me 1 mm of her mucosa which is spared. Look at her palpebral fissures. Look at her nostrils. Look at her oral cavity. Look at the pain in her eyes. Look at her palate. Can you help her? This was the biggest challenge that we had. And like I said, I had no freaking clue why I was carrying my laser with me that day. I had no business to carry it. So somewhere I felt that this lady deserved, or rather, it was written in her destiny that she could heal so well in a matter of 3 sessions. How? What must have gone right to bring her from the left to the right in a matter of 3 sessions? How? Look at the palette. How would you manage this with a damn Kenacort that we are so fond of, prescribing steroid pastes and prescribing benzodiazepine hydrochloride mouthwashes? Is that what oral medicine is all about? Oh my goodness. If that was the message that was understood loud and clearly by this fraternity, we would not have oral pathology and oral medicine seats going vacant today. Sad part of the story. Ladies and gentlemen, here I present to you the 21st century Aladdin's lamp. Why do I call it the 21st century's Aladdin's lamp? The results are right in front of you. Why am I showing you this case? Just to give you an understanding that you and me can do much more than simply doing root canals and implants and the routine mundane stuff. Please don't get me wrong. I am not demeaning any of it. I respect this science as much as I respect my teachers who have taught me this. But I am not going to die holding a K file in my hand. I want to explore the entire gamut of what I can accomplish as a dentist, right? And this is going to be possible because I have this Aladdin's lamp which I rub and the genie comes out and tell, "Kya karna hai? Ye karo mujhe. Heal this patient. Help them out." This is what I do for a living. Let's get started now. Let me show you what this 21st century Aladdin's lamp can do. And this is what I call LaserVEDA, because this is something that the world doesn't know of. For me, it is nothing short of Eureka, right? And the day I realized this, LaserVEDA is my middle name. And the stories keep continuing every day. This is a 9-year-old kid with a full-blown Steven Johnson syndrome. Have a look at his lip. All that was done to him was simple red light therapy. Nothing else. Not a single medicament was used. Not a single ointment was used. Nothing. Just simple red light therapy. This is how he turned up 48 hours later. And this is how he turned up on the 5th day. Ladies and gentlemen, please tell me which plastic surgeon in the world can give you this kind of an outcome in 5 days. Why am I showing you this? What's the connection? The connection is very simple. You do uncommon things, you get paid uncommon fees. You get paid for the type of problems you solve. You solve bigger problems, you get paid more. As simple as that. So let's now get into this whole concept of healing with lasers. Why this is something that comes as a surprise to us. Why we have never heard of photomedicine. What is photomedicine? Photomedicine is nothing but using light as a drug. So this is the paradigm shift. This is the quantum leap that we are supposed to take in the 21st century. I believe this is the best time to be a dentist because the kind of technological advancements we have at our fingertips, that leap is not so difficult. The leap from a pharmaceutical dominated era of healthcare to a photoceutical future of healthcare, which is so very evident and so very so very present. I'm not talking to you about some kind of a science fiction. This is the Wellman Center for Photomedicine, where photomedicine is used for anything and everything from hair growth to tinnitus, deafness, infertility, wound healing, Achilles tendonitis. Please pay attention to the topmost line there: brain, stroke, traumatic brain injury, Alzheimer's, neurocognitive disorders. Dentistry, pain and mucositis is a minuscule part of this whole system. It's a minuscule part of it. Don't believe me? Please go to Massachusetts General Hospital. This is actually happening day in and day out. Why does this come as a surprise to you? When I show you this blue baby chamber, you are not surprised, because we all know that bilirubin levels start dropping the moment the child is put into a blue baby chamber. How? Neonatal icterus is such a big problem, and every small pediatric center today has got a blue baby chamber. How? Did you ever question how blue light can break down bilirubin? There is a different story for that. Let me not go into the detail because I have to wrap up in the next 30 minutes. We can speak to each cell in our body if we know their language. What language am I talking about? English? No. The language of light. Your body cells and my body cells respond to only two things in this world: sound and light. Ever wondered why you feel peaceful when you go to a Buddhist monastery and you hear all those bells ringing? You go to a temple, you hear the chanting. You go to a mosque, you hear the reciting of the Quran. You go to a church where a prayer is on, and you hear those those uh, those sounds, those chantings which soothe you down because your body responds to it. It responds to light as well. That's the language that I'm going to talk about. So when you talk about the old school of laser science and you think that giving a bloodless, painless, sutureless outcome is the entire goal of the laser science, you are only glorifying the burning glass principle. This is what we do. We intensify the beam into a beam which is so powerful in terms of the heat that it is carrying. It literally dumps the heat from the photons to the tissue water, and the tissue water starts boiling. After it crosses 100 degrees Celsius, it has to vaporize and go out somewhere. It will rupture the overlying mucosa, and we become happy because the blood vessels are sealed at 70 to 80 degrees Celsius, and the ultimate ablation happens beyond 100 degrees Celsius, and we have achieved the great cut. Awesome. In fact, the sad part of the story is that a lot of the so-called pundits compare a laser with an electrocautery. Wow. Awesome. Science and convenience don't go together. Either you do what is convenient for you, or you do something that is scientific. How many cells do you think you damage when you use a scalpel or an electrocautery? Not my work. This is from the legendary GISP 2 to 2014. And what about lasers? You touch 15 to 20 cell lines with a diode. You touch 5 to 10 cell lines with an erbium. I'm not glorifying cutting at all. Still, if somebody compares a cautery to a laser, my blood starts boiling, because how ignorant can people be? I mean, if you love the smell of the cautery, fine, go do it. But even when you are glorifying the burning glass principle, which in itself is wrong, you go one step further and you have the audacity to compare that with an electrocautery. You are just proving your ignorance. I'm sorry. Like I said, science and convenience don't go hand in hand. It is either convenience or it is science. So basically, cutting the long story short, when you use a laser in the surgical form, you're either incising something, excising something, or curating something. So your basic primary goal is debridement or removal of a noxious foci. Correct? Now I'm talking to you about a different language where a right wavelength of laser is used in a non-thermal therapeutic manner. So when there is no dumping of heat from the photons to the tissue water, but a mere stimulation of ATP production, what do you think will happen? That's the entire magic that we scientifically call as photobiomodulation. The more colloquial way of calling it is photomedicine or laser medicine, right? So basically, we use photons here also, specific wavelengths which are absorbed by specific chromophores, but this is an entirely non-thermal process which will lead to production of ATP, plus release of endorphins, enkephalins, serotonins, the feel-good hormones, analgesic effect, anti-inflammatory. It has the capacity to even change the phenotype of a macrophage from a M1 phenotype, which is pro-inflammatory, to an M2, which is anti-inflammatory. I'll come to that in a little while from now. This is based on the principle of photobiology. Again, this should not come as a surprise to us, because we know that even plants have got a pigment called chlorophyll which absorbs sunlight, and that's how they produce their food. We have never questioned this. The same way, we need to understand that our body has also got chromophores, especially in the mitochondria, which can absorb light, and the cells into which those mitochondria are housed will obviously give a positive cytological response to these photons. This entire thing is scientifically called as photobiomodulation, using light to modulate living cells. Is it so difficult to understand? I don't think so. So whether we are talking about neurology, whether we are talking about oncology, whether we are talking about any other system in the body, it has to obey the laws of photobiology. Simple as that. All the body cells behave in the same way. I'm a pediatric dentist. I'm interested in odontoblasts laying down dentin so that I don't expose the pulp in a primary tooth which is badly infected. A renowned periodontist implantologist who's doing 100 implants will be bothered about osteoblasts because he wants a solid bone to be laid down. That is how he's going to get osseointegration. If I cut my hand, if my skin is denuded, I want epithelial cells to come there and lay down a new layer of skin. All the cells in the body work the same way. In fact, if the cells are healthy, the tissues will be healthy. Healthy tissues give us healthy organs. Healthy organs give us healthy organ systems, and that's when an organism is called healthy. Is it so difficult? This is simple biology. We got so obsessed with our mechanical concepts in dentistry that we have stopped thinking like biologists. So if I talk about something that is a little complicated to understand, it sounds like mumbo jumbo. It is not. You just give adenosine triphosphate to each cell, the cell starts dancing with joy, because that's the currency. That is the currency that the whole cellular function depends on. And who gives that currency? The mitochondria. And how do you stimulate the mitochondria? The inner membrane, the outer membrane, we have got a chromophore called cytochrome C oxidase, which absorbs specific wavelength of light and gives adenosine triphosphate. So the mitochondria is the powerhouse of the cell, and that's no longer a secret. We all know that. So the interaction of red and near infrared wavelengths of light with those specific chromophores within each mitochondria of the human cell is what is going to give us the desired results. So when you saw that lady healing from a methotrexate toxicity, this is what was happening. When you saw that 9-year-old kid, healing with that full blown Steven Johnson syndrome, this is what was happening. It's as simple as this. We don't let our phone batteries die, right? We charge them diligently, religiously, every day, night. The only way how you can recharge your body cells is to plug them into the right wavelength of light. I could not have made this simpler. So, what's the step in understanding photomedicine? Let's run this quickly. You remember this character, right? We are jadus in our own selves. Pun is intended, not jadus, right? We can also absorb light. We can absorb specific wavelength of light between 600 and 900 nanometers, and our cells can respond positively to it. That's the biostimulatory range. You can't pick up any damn laser that you have and then try to do these things. There is a specific optical affinity between chromophores and the specific photons of wavelengths represented by the 600 to 900 range. And what's so special about the laser light? It is monochromatic, made up of a single color. It is unidirectional, collimated, and each of those photons that make up this beam are spatio-temporally in synchrony with each other, which we call by the word coherence. So that's what makes laser the purest form of energy. It's a shame that we were using this energy only to cut tissues until now. If we can use this energy for healing, that's going to be the story of every healthy cell. We are going to use a specific wavelength of light to transfer that energy to cytochrome C oxidase, and in return get the adenosine triphosphate for the cell to achieve cellular repair. If it is going slowly towards a slow cellular death or apoptosis, we actually have the mechanisms today to reverse that journey. Yes, this is anti-aging in every sense of the word. And the site specific tertiary effects are pro survival towards tissue repair. Like I said, it can stimulate TGF beta, transforming growth factor beta, which is so important for healing. It can enhance cell motility, decrease apoptosis, decrease inflammation and necrosis levels by controlling the oxidative stress. What are the systemic bystander effects? You end up resolving inflammation. You change a pro-inflammatory cascade towards an anti-inflammatory cascade, achieve profound amounts of analgesia. You can use it for any kind of a cellular stimulation, whether you want osteoblast to be stimulated, whether you want a multipotent differentiation of odontoblasts, fibroblasts, endothelial cells. You just have to rub this genie. This is the 21st century Aladdin's lamp, which will actually give you what you want, provided you understand the language. And to summarize what I have discussed so far, what is the result of photomedicine and what will be the clinical effect of it? So whether it is a decrease in edema, reduction of pain, or increase in the stimulation or growth of bone, dentine, or soft tissues, it's going to help in every facet of dentistry, not just the simple healing. It is going to help in every aspect of dentistry. This is one of the cases done by our fellowship students. Have a look at this ulceration. How does this look? Looks good, looks bad. Looks pretty bad, right? There is a sharp tooth there, and if it is left unattended, even now a lot of people would feel that a biopsy is needed. This doesn't look good at all. It may not heal. What was done? Simple 660 nanometer red light therapy. How is this possible? This is possible because of the mechanisms that we discussed so far. Can you put a price tag on this? If you can reverse an ulceration from getting worse, Can you put a price tag on this? We are going to be the oral cancer capital of the world very soon. So more than anything, we need to be aware of what we can do with this biomodulatory laser science. Actinic cheilitis before and after. I'm short of time. I can't explain each case in detail. My idea here is to just change your thinking and make you understand that you can use the laser in a non-cutting form for membrane repair, cell migration, extracellular matrix synthesis, you name it. It's possible because you know the language of light that the cells understand. Cheilitis granulomatosa, allergic reaction to a toothpaste maybe before and after. Again, simple photobiomodulation, no use of any medications or no use of any drugs, just simple red light therapy. So you get paid for the problems you solve. I come back to that cliched definition, which I love. Now there may be a few of you who would be wondering that hame nahi karna ye sab. We would like to do the simple stuff. We would like to practice day-to-day dentistry. Do we have any applications? Yes, you have. Absolutely. But let me first show you what is possible with it. Have you heard of this? Short-lasting unilateral neuralgiform headache with conjunctival tearing. This is the worst possible form of trigeminal neuralgia. So if you're wondering that you have done a root canal well or you're an extraction well and still the patient keeps coming back with pain, please understand it could be non-odontogenic in origin to begin with. And today we have the techniques to integrate advanced laser medicine with it. This is how we treat it in a non-invasive manner without spilling a drop of blood. Can you put a price tag on that? Right, this is how you connect that to the anatomy that you're treating in a completely non-invasive manner. All that you got to understand is which wavelength you're using at what dosimetry. Right, this sounds like mumbo jumbo, but this is an established science. There are more than 30 papers added every single month. You pick up anything, you pick up the British Medical Journal, you pick up the Lancet. There are more than 5,000 clinical trials. Of course, we have evidence related to dentistry, which is strong, moderate, or low. Each of these things fall into the respective categories. If anybody interested in reading this paper, I'll be more than glad to share it. This is the entire list of what we can do with this amazing science in dentistry: endodontics, maxillofacial, oral pathology, oral surgery, whether it is burning mouth, herpes simplex, lichen planus, mucositis, TMJ disorders, paresthesia, alveolar nerve damage, acceleration of orthodontic tooth movement. Seriously? Yes, hold on. Maybe if I have time, I'll touch upon that part. Enhancing bone implant interface strength. Seriously? Yes, because you are stimulating osteoblasts. And these are not my fits of imagination. I have a reference which is cited here right on your screen. And any of these papers, anyone would wish to read, they are available online, and I'm here to send them across to you. What the mind does not know, the eyes can never see. I was also a cutting laser specialist like all of you, and this is when Dr. Jan Tuner changed my mind and said that stop looking at laser as a substitute for the drill and the scalpel, and that changed everything. And then when I met this guy, I mean, it blew my my head off, literally, the kind of work that he's doing at the Wellman Center for Photomedicine, treating traumatic brain injury, Alzheimer's, neurocognitive disorders, autism spectrum disorders. He treats depression patients by using different wavelengths of light. Can you beat this? Right, in fact, this is, you can take a screenshot of this. This is a entire list of pharmaceutical drugs that have been compared head to head with a non-pharmaceutical light alternative, from acyclovir to celecoxib to chlorpromazine to dexamethasone to diclofenac to gabapentin. Various trials, various diseases with references. Light as a medicine is serious business, and like I keep telling you, get paid for the problems you solve. You want to solve simple problems? Let's come to our day-to-day simple things. Now this is the most interesting part of the presentation, how it can boost our revenues. Let's say we are doing endo. What do endodontists dream of? Endodontists dream of making their endo completely painless, 100% predictable, and they want to prevent and treat apical periodontitis. They don't want the inflammation. They should not be scared of a flare-up after they do a single visit obturation. They have to go back and sleep peacefully. They should not be worried that there will be a flare-up the next day. Plus, the most important thing, they have to be sure that their canal systems are three-dimensionally rid of each and every microorganisms, including Enterococcus faecalis, which can be found hiding up to 1000 microns laterally into the dentinal tubule surrounding the main canal. Forget the damn MB2. I'm talking about the main canal, which can harbor Enterococcus faecalis up to 1000 microns laterally. And the only thing that can reach there is light. For doing that, let's do some math now. Let's assume that you start practicing 3D endodontics with lasers and you charge 1,000 rupees extra for each patient that you do. How much do you think this will ultimately reward you with? If you're doing 5 root canals per week, the laser revenue per year turns out to be 2,40,000 rupees. If you are a busy endodontist who's consulting from one clinic to the other and ends up doing anywhere between 10 and 15, you end up making 4 to 7.5 lakh rupees only by enhancing whatever endo you are doing by a 1,000 rupees upgrade to laser assisted endodontics. This is not what is the revenue that you make with endo, please. This is the revenue that you make by charging 1,000 rupees extra for giving that upgrade to your endo from a regular endo to a laser assisted endo. How? This is Parkinson's economic law working in your favor. Parkinson's law says that work expands to fill the time available for its completion. If you are decided in your mind that you're going to take 2 or 3 settings because you can't completely get rid of the infection that is there in the canals, you will obviously spend 45 minutes on each appointment and block the chair. If you are a periodontist, you will spend 4 appointments raising the flap, closing the flap, and suturing it. If you understand the Pareto's principle, 20% of your inputs determine 80% of the outputs. Then comes the magic of the CY1K rule. CY is self-explanatory. 1K is that 1,000 upgrade that you give, where you complete the entire procedure by using a laser and charging 1,000 rupees extra for what you have already been charged. You charge 4,000 rupees for a perio quadrant flap, you make it 5, and that's going to make a world of impact. That is what I call it as the CY1K rule, because, ladies and gentlemen, laser is not just an excellent medical tool, but it's also an excellent marketing tool. How do I say that? Why do I say that? Let me quickly touch upon this. What's the ultimate goal of every dental practice? You need more consultations in your clinic, and you need more consultations to convert to treatments. Is it rocket science? No, this is simple. More patients who will decide to get their treatment done from you, even if you are more expensive than the competition. Now that's something, right? This is as simple as it gets. You need more checkups and you need more conversions. More conversions despite you charging more. How does that happen? How does that happen? How does a lady buy a car? And lady, no gender specific thing, I'm just trying to make up a story. She understands the features of the car, she takes a test drive, she understands the warranty information, she checks the prices and decides which car to buy. What happens when the same lady comes to buy dentistry from you? She doesn't understand the technicalities. Your sharp line angles and round point angles, a professor like me can pick out, not anybody else. It's of no use, right? How flat your pulpal floor is, that era of amalgam is gone. Your patient will not appreciate it. She's worried more about how painful the whole procedure is going to be. She's not even sure if the treatment is going to solve her problem. Then obviously she's stuck whether to stick to Dr. A or try a second opinion with Dr. B. So how does she decide? According to the research done by Gabriel Azulin, how patients choose a dentist, the perception or the professionalism about the dentist matters 53%. The personal charisma or attitude is only 31%. Your clinic location and ambience that you just splurged money on the renovation is only 9%. Hello? If you thought that you should be charging less to attract more patients, the actual cost or the expense is only 7% determinant when it comes to how patients choose a dentist. This is a properly done research. So now what professionalism am I talking about? What is this 53%? The biggest paradox in dental marketing is that on one hand, the patient wants a dentist with highest levels of professionalism, or at least the perception of. But how are they going to decide it? Are they trained enough? Majority of the medical professionals that I interact with do not know that there is a specialty called pediatric dentistry that exists. And we are talking about patients understanding our professionalism before making a decision to get the treatment from us. No, it doesn't work. Then what works? How do you think patients will decide? By seeing or knowing about the technology that is installed in your clinic. Trust me, it has worked with me or for me in my favor in a small town like Hubballi for 17 years. People flock to me purely because of the technology that is installed in the clinic. They will judge me based on the impression that they get when they see all these fancy lasers with me. What I do with them, I'll be knowing, and probably my assistant will be knowing. Is it so difficult to understand? Imagine you have an old parent at home who needs a cataract surgery. Will you hunt for the cheapest ophthalmologist, or will you go for an ophthalmologist who's using the most updated laser? Lasers and ophthalmology go hand in hand. We seek the best ophthalmologist even when we know that a laser ophthalmologist is more expensive than a general ophthalmologist? Would you go to a general ophthalmologist just because he charges less? No, you would not do that. And what makes you think that patients feel the same when they have to choose between a laser dentist and a general dentist? Is it so difficult to understand? We don't even have to reinvent the wheel. The goodwill that the laser technology that has already earned in ophthalmology, in derma, in other sciences, people assume that the moment you brand your clinic as a laser clinic, people assume or perceive that you are more precise, you are more accurate, which you are. I've given you enough instances for now, but they will not understand it. But the fact that you brand yourself as a laser dentist or as a laser clinic, somewhere innovation becomes your middle name, technology becomes your middle name, right? And that's the magic of the CY1K rule. Whether you are doing it for cleaning, whitening, just imagine you are walking into economy class Emirates flight and they say, sir, you get a business class upgrade for 1000 rupees. Which idiot would say no? Imagine every scaling patient who walks in, you give a 1000 rupees upgrade to laser whitening. Look at the revenue that you are generating doing a cleaning, or rather laser enhanced scaling. You can make anywhere between 5,76,000 to 20,16,000 rupees just by giving that 1000 rupees upgrade for the laser tag. Amazing, isn't it? I'm just showing you the mirror. And for those of you who thought that I already have I don't want to take names, lamps which can whiten teeth. Hello, they are all monochromatic maybe, but they are not coherent. When you are using a laser whitening system, you are using a coherent beam of light, so the effect is, I mean, unimaginable. You can't compare apples with oranges. When you use any other generic light, however fancy the name may be, that particular photon or the beam of the light that you are using is non-coherent. You can't compare that with a coherent beam of light. Forget, the advances like non-peroxide, non-destructive organic whitening which get activated with an 810. I'm talking about even the general lightning lamps. You can't even compare laser whitening with a regular lamp whitening. You don't even want to do that. You just want to do painless extractions, bloodless extractions, sutureless extractions. Just use a laser upgrade to your regular extraction, charge 1000 rupees more. If you are smart, doing nothing else in your clinic, only doing laser and doing an extraction, you can end up earning 23 lakh rupees per annum only by doing this. The math is in front of your eyes, right? Of course, like I said, you need to brand it. You cannot drink a dirty coffee unless it is having a tag of Starbucks. Imagine, I did that yesterday in the airport. Trust me, I can give you a first hand explanation of how horrible it was. I would have loved to pay 20 rupees across and had a filter coffee, but the logo makes a difference, right? E equal to MC square, energy equal to milk and coffee. I mean, creativity has got no limits, ladies and gentlemen. Now comes the biggest creativity myth. All this I explained, would you believe me if I say that you can do with a 99,000 rupees laser? You don't need a cutting laser for this. You just need a photomedicine laser, which comes at 99,000 rupees. You thought laser dentistry is expensive? Laser dentistry is not. But the ignorance about it is definitely expensive. You can recover this in 9 to 12 weeks if you apply the principles that I've just told you. 99,000 rupees is less than the iPhone that you have recently spent your money on, right? Investment versus revenue boost. How did you not know this? Because no manufacturer will tell you this. They will try to burn your pocket by asking you to go for a higher wattage machine and burn the tissues and then blame the laser science that I could have done this with a cautery. Awesome. The greatest enemy of knowledge is not ignorance, it is the illusion of knowledge. So if you thought that you knew everything about lasers, it's high time we go back and read and see and understand what's happening. You don't need a cutting laser for doing all this. You need a therapeutic device which starts from 99. Of course, if you want to add the surgical options to it, then it becomes complicated. The circuit changes, the fiber optics change, lenses come into the picture, and then it crosses the 2 lakh mark. But if you are happy doing whatever I have just told you, you can do that with a 99,000 rupees laser, right? I get fascinated when I see this guy on television, the way he diagnoses cases, right? The good doctor. I'm also a good doctor, but I never got that kind of a credit. Then I sometimes feel weird when I see house MD. People call me house MD sometimes, some of them at least, because they think that I can diagnose and do a magical treatment plan. But yes, I would love to believe that I am competent enough when it comes to the itch that I have, that I should have been a neurologist or an oncologist. That itch gets fulfilled whenever I use photomedicine, especially for cancer patients, especially for oral mucositis. Now comes the last part of the presentation where you can make a world of difference. You can be a lamp or a lifeboat or a ladder to help someone's soul to heal. If I'm teaching you laser science, it's my duty to tell you how to make money with lasers. At the same time, I need to tell you that when you're treating a cancer patient, you may not be able to add more days to their life. At least try and add more life to their remaining days. Makes a huge difference. This is an 11-year-old kid on cancer therapy for nasopharyngeal cancer, comes up with mucositis full blown. That's what I told you. An M1 phenotype can change to an M2 phenotype, and from here to here, it took just 3 sessions with PBM. Can you believe that? How would you help a 11-year-old with nasopharyngeal cancer? This recently got published as a novel treatment approach for the management of radiation-induced oral mucositis. Again, I have to rush. I'm running short of time. Lymphoma post chemo. The oncologist of this patient called me worried that the lady is losing weight. She is not eating anything and she's missing her chemo cycles. So if you think that you are in any manner less than any oncologist or neurologist, please stop thinking that way, because all these so-called accomplished medical professionals may be good in their field, but when it comes to complications in the oral cavity, they have no freaking clue how to manage it. This lady comes with a slit on her tongue. She's not even able to swallow water, and the oncologist panics because her lymphoma is getting more aggressive because she's missing her chemo cycles since she's losing weight as she's unable to eat. That we took was 6 days to send her back to her chemo. And that's the recent multinational supportive care cancer paper, which says that photobiomodulation or photomedicine is now mandatory before any patient starts for any radiation or any chemo for any cancer, not just oral cancer, right? With oral cancer, it becomes all the more challenging. And that's my paper. I can share that if anybody wants to read. The optical footprint has to be right. So cancer wellness is going to be a big thing coming into the future. 2025, we are all set to become the oral cancer capital of the world. In fact, we are now finding different ways of using laser auricular medicine for tobacco de-addiction. How cool is that? On the 9th of April, I'm speaking for this organization called I Can Care, which is like an organization which is working for tobacco cessation. And they have this April 9th, they have this oral cancer awareness campaign. And in the afternoon, I think 3:30, I'm speaking on this new aspect of how to use blue diode fluorescence. That is again a light-based strategy to understand whether the mucosa is in an oxidized, the FAD, the flavinadenine dinucleotide, is in an oxidized state or non-oxidized state. You pick up a healthy green glow and the mucosa is found to be normal. If you pick up a black spot, you can suspect that the patient can go in for a malignancy 2 years before the actual lesion becomes evident. This is what we call it as the modern day version of the surgical biopsy. We call this as the optical biopsy. And then you can put this patient up for tobacco de-addiction just by using light. Beyond the scope of this, now how do you choose the right laser? Last 3 minutes before I stop, you don't choose the right laser, ladies and gentlemen. You choose the right wavelength, right? Don't fall a prey for the wattage. It makes no sense. The wavelength is what is important, because different cytochromes, especially different chromophores like CCO, have different range of absorbing specific wavelength. So when you go closer to the 1000 mark, you lose that ability. You cannot use that wavelength for photobiomodulatory application. So if you are reading Diffretas or Hamblin, you will be astonished that all the work that they have done in their entire life is only on 660 or 800, because those are the only two wavelengths which have enough energy per photon. The moment the wavelength increases, the energy per photon in joules starts coming down. That's the concept of photon fluence that we are working on right now. Now, who will tell you this? You thought that a 940 or a 980 is better than an 810? Only God can save you. Look at this equation. The lesser the wavelength, the more is the energy carried by each photon. So that's the reason why the World Association for Laser Therapy has now recognized 810 as the gold standard. We call that as the Einstein. So all other wavelengths are pitched against 810 to understand how much you have to tweak the dosimetry to get your treatment right. In spite of this, you also need to understand how complicated or how uncomplicated or simple your laser is. This is how typical laser settings look. With continuous wave, pulse, they confuse you to the core. Rather than that, go for a simple 1 2 3 4, where an artificial intelligence backed interface gives you, automatically decides when to give you continuous wave, when to give you pulsed. You just have to select the right button and the job is done for you. So in this era of driving an automatic car, if you want to go back and drive a geared car with all kinds of stupid things seen on the screen and confusing you with when to use contact, when to use pulse, when to use CW, choice is yours. 810 can also be used for pediatric pulpotomies. It can be used, this is my work on that, it can be used for accelerating orthodontic tooth movement. That's a systematic review and meta-analysis that we recently did. I'm sorry, I'm running short of time, I cannot complete the entire text on that particular article. But yes, if you're using Invisalign, if you're using MBT, Roth, or any other fixed orthodontic prescription, the least that you can get is a 44 to 45% of enhancement in the acceleration of orthodontic tooth movement based on the rank rankle OPG hypothesis. OPG is osteoproteogene. It's a decoy receptor which blocks rank and rankle, and it is the chromophore for us to photo dissociate and allow the docking of rank and rankle to happen so that you get controlled uh, retraction, right? So perio and implantology. Last part of the presentation, we work on what is called as photodynamic therapy, where a specific green colored dye is used with 810. This dye is placed in close proximity to the periodontal pocket or the endodontic canal or the peri-implant surface, allowed to soak for 3 to 4 minutes, and then you activate it. If you're worried about quorum sensing, if you're worried about bacterial resistance to antibiotics, then PDT is the answer for you, because it's a physical phenomenon. None of the bacteria, none of the microorganisms can ever get resistant to PDT, because it's purely a physical process. So if from quorum sensing to quorum quenching, now we're working on chitosan nanoparticle enriched ICG. Don't pick up any dye that you think is green or any you think is blue. There is a lot of science that needs to be understood before a dye is used for photodynamic therapy. This was one of our old cases where we extracted the tooth and placed the implant in a completely infected socket, and then continued doing PBM. Biomechanical effect of one session of low level laser or PBM on the bone titanium implant interface. This is the paper for you. The next one will blow your mind. Low level laser therapy, that is laser medicine for implants without initial stability. Now this should not come as a surprise to you, because you know now what it takes to stimulate the osteoblast, even when you know that an implant is failing and it is not able to osseointegrate. Look at this paper. It says that in the initial stages, even when there is poor initial stability, you can reverse that by using lasers in a photobiomodulatory mode. This is how it works. Non-invasive, not a single drop of blood, just 810 nanometer laser with the right optical footprint is what is needed, right? That's the paper for you. Of course, you need to choose a brand which has got safety certifications. You need to choose a brand which can teach you, which can, hold your hand and certify you at the same time. Don't fall for false claims. People tell that we also use the same diode, the same engine. Obviously, if you're following Formula 1, Mercedes V6 turbo engine is used by Mercedes also, McLaren also, Williams also, Aston Martin also. But there is only one winner, right? And that winner is the person, or is the company, or the organization which will change the future. Because I firmly believe that people who are crazy enough to think that they can change the world are the ones who do. And that's why uh, I firmly believe in that. It was an absolute pleasure and an honor to be speaking to all you beautiful people on this Thursday evening. I thank Dr. Rajiv Chidgupi sir and the entire ICPA group for having me here. That's my new book, which is going to hit the stands soon, LaserVEDA, Healing at the Speed of Light. Please read it. It will be on Amazon soon. Read it and give me your feedback, whether you liked it, and how I can make it better. It was an absolute pleasure being here. Thank you so much. Any doubts, any queries? I think we'll be having some time left for a quick Q&A.
Thank you. Thank you, Dr. Yavagal. It was mind blowing. And you were running at your fastest speed to make sure that you cover everything that you had on your mind before the stipulated time. But I'm so glad that you covered everything. And it was something that came as a total change in what we used to think, how we used to think about tissue healing, different conditions. And after watching your webinar, I have come to the conclusion that if I come across any case where I have tried my everything and I'm not getting results, I should just stop thinking further and refer the case to you, because you know the
No,
wavelengths,
no,
you know
no,
how
no,
to make use of the photo medicine, stimulate the cells and make sure they will heal the way they should be. So that was an amazing talk. You covered right from oral mucositis cancer to orthodontics, periodontics, implants, trigeminal neuralgia. So it's a very wide spectrum where we had not even paid attention for such a long time. It was so heartening to see the way the people recovered. 3 sessions, such short time in 1 week. All those cases were really, they gave us a lot of hope that the conditions may look very, what you can say, scary on screen, but there is one tool that we have that can help our patients get back on track, get back to their life. So it was really enlightening. Thank you
thank
so
you very
much.
much. Thank you very much, sir.
There are a few questions that I want to put
Please, sir.
across, or registered people have asked. Can LLLT be used in root coverage procedure?
I'm so glad that somebody knows that this thing is called LLLT. I mean, so happy that we have a learned audience here. Uh, Absolutely yes. I think this question should be coming from a periodontist, since it's root coverage. My advice to that young doctor, whoever it is, would be to use LLLT or use photomedicine wherever you use your scaler and your scalpel. Simple as that. So after this presentation, you would have understood that you cannot cause any harm to any tissue because you are using it in a non-thermal manner. If you don't get the desired results, that means we need to just tweak the dosimetry. We may be slightly on the inhibitory side. We need to reduce the dose. We may not be using the right wavelength. For example, there is a patient who comes to us with fever. How do we know that we have to give paracetamol? We have studied the pharmacodynamics and pharmacokinetics of that drug for 1 year in our pharmacology. We know that dolo has to be given at 650 milligrams for an average 70 kg adult. It has to be taken 3 times a day. If he complains of acidity, gastritis, what do? We either give a cover of pantoprazole or we reduce the dose of paracetamol. Simple as that. So when we are, whether it is root coverage, whether it is periodontal pocket debridement, whether it is a laser assisted new attachment procedure, if you're not getting the desired results, it all boils down to, are you using the right wavelength? If yes, your dosimetry may need a little tweaking. Anything on the lower side of the dosimetry, that means anything in the range of 4 to 6 joules, is stimulatory. Anything above 10 to 12 joules is inhibitory. So are we doing anything wrong in that way is the only thing that we need to ask. Nothing else.
Great answer. So there was another question by Dr. Kripa Shankar. Any quick update on dosimetry? And you just classified what happens when you go above 10 and how you can stimulate when you stay below 10.
Yes, sir.
Okay, a lot of compliments.
Thank you, sir.
People have liked the presentation. Okay, there is one question here. Any comments on blue light laser?
Yes, we are working on the blue light. Blue light has its own advantages. I just told you about blue diode fluorescence. Now, blue light is so important for us for optical biopsy that we are working now on a device which can detect oral cancer 2 to 3 years before the lesion becomes evident in the oral cavity. Of course, we also already have those in an LED form, blue diode fluorescence, but we are trying out with the laser device if we can use coherent light to detect abnormalities in the oral mucosa. Because like I keep telling, we are going to become the oral cancer capital of the world, and our great so-called stars coming and talking about using surrogate advertising methods of of a certain brand of
Products.
vodka or whatever is not helping us. 2025, just to give you a perspective on this, 2020 was the peak of COVID in India. We lost about 1,48,000 people to COVID. Any idea the same year how many people we lost to oral cancer? Close to 1,09,000 people died because of oral cancer or its related complications. So which one is the pandemic? COVID may have affected us once or twice, but this is an ongoing problem. So blue light is going to be our savior in this. Point number one. Blue light has got excellent optical affinity to hemoglobin. excellent. So when we use a 450 or a 460 as a wavelength as a surgical tool, you don't even have to touch the tissue. You can do a non-contact surgery with a blue diode at half the wattage. So that's one more exciting area where we can explore the possibilities of using the blue wavelength for cancer diagnosis as well as for non-contact diode laser surgery.
Great, great. Okay, there is this question by an oral surgeon. Can we do incision with this laser and then close the wound later? Example in cases of impaction surgery.
We can, sir. What happens is there is a concept called laser bandage, where we just reapproximate the flaps and then we do photobiomodulation over that. So it's very well known and well practiced technique. In fact, if you are an oral surgeon, if you are doing a lot of third molar disimpactions, I have a small suggestion for you. All those third molar disimpactions which are close to the inferior alveolar nerve bundle, where you know that you are going to end up causing paresthesia, you don't have to rely on neurobion anymore. You just have to prophylactically run the photomedicine probe, that is the right wavelength if you're using an 810 or a 660, all across the course of the inferior alveolar nerve, even before you place your incision. And please repeat this after you have done your disimpaction. The patient will go back home without paresthesia, without any pain, and trust me, you don't even need a Dexona shot intravenous for preventing the swelling the next day. Please try this and come back to me if it doesn't work.
Great, great. How can we use after scaling and how it will help?
I would rather advise you to use it before scaling. The perception of the scaler would reduce so much, and the vibration and the comfort levels will be so good that the patients will love the experience. After scaling, obviously, if they are having any sensitivity, it will vanish within 40 to 45 seconds. Or after scaling, you want to use something like a CPP ACP varnish for long-term protection. You can apply that and then use the low-level laser. It will have a iontophoretic effect as well. So it will drive the ions much deeper. So you can use it before scaling, after scaling, the way it works for you.
Okay, okay, great. Uh, can you suggest some books to get basic knowledge about laser? I think your upcoming book should give
No,
all the
no, no,
knowledge.
no. You can read any work by Jan Tuner or Michael Hamblin if you want to read about photomedicine. Bob Convizar if you want to read about, or Moritz if you want to read about the surgical aspects.
Great. Another question, but this is about your book. When will your book be available on Amazon?
I have to stop traveling and sit in my at one place and then complete it for a month. So that's the answer for it. Just Srinivas Naidu, sir, if you are the person who has asked me that question, thank you. I mean, you have shown me the mirror. I have to seriously sit and finish it now.
Okay. What pulse width of laser you are using for treatment?
Sir, my philosophy is very simple. I don't use the pulse mode at all for any of my PBM activities. All my PBM treatments are in a simple continuous wave. For a simple reason, when you are using a pulsed mode, your dosimetry goes haywire. Right? For example, if you're having a 50% duty cycle, your average dose is completely different than the planned dose that you want to give to that particular patient. So I want to keep things simple. All my PBM applications are done with continuous wave. All my surgical cutting is obviously done with a pulsed mode, because between two pulses the tissues get time to cool down.
Great. Very, very clear. How to use laser in root canal disinfection?
Extremely easy, sir. What we need to do is we get a 200 micron endodontic tip. Now the recent advances, we have got polyamide tips which can actually bend, so you can bend it 90 degrees and then take it inside the canal. I would advise you not to take it in a dry canal, so make sure that either there is some sodium hypochlorite or a liquid ETDA, or at least some saline inside the canal, and then use that laser at 1 watt continuous wave for 15 to 20 seconds in concentric circles. Make sure that you keep withdrawing the tip at least by around 1 mm every second. That's in the photothermal mode. Or if you are fond of PAD, photo activated disinfection, we now have a specific dual wave endo laser where we are using chitosan enriched uh, toluidine blue, which can be placed inside the canal, allowed to soak for 3 to 4 minutes, and then you use a specific 660 nanometer laser to activate it. That will be in the non-thermal mode. Both will give you extremely good and effective canal disinfection.
Great. One more endo-related question. In case of pulpitis, is pulpitis curable by laser? In short,
No, pulpitis is not curable by laser. Basically, when you use a laser, any itis, any pro-inflammatory condition changes towards an anti-inflammatory condition. So the patient will get relief from the pain of the pulpitis. But is that a cure for the pulpitis? No.
no.
If it is irreversible pulpitis, you still have to go ahead, do the access and extirpate the pulp, and then complete your root canal therapy.
Great, great. Do laser devices need calibration with particular time period?
Absolutely, yes. And that's the advantage of going for an Indian device, because it's like sending our car for a periodic service. What happens is that every 2 years or 3 years, we are basically talking of semiconductor chips. So the gallium, aluminum, and arsenide, which are there as raw materials used in the semiconductor chip, the quality of which we can never make out. That's why we have to rely on those units which have a CE certification, which have all these certifications, so that we know that we are getting the right photons for the right output. And this output keeps changing with time. It's a semiconductor chip. So every 2 years, it is worthwhile to send the unit back to the manufacturer and check that what 1 watt, what is shown on the screen, are you really getting 1 watt? Or the efficiency has come down, which needs a little bit of recalibration, so that your dose that is shown on the screen and the dose that you wish to deliver are on the same platform.
Okay, great. How to use it in extraction sockets?
Extraction sockets, again, like I said, my advice would be to hang that laser right next to your handpiece. It should be used for every case. Before you end up getting into the socket, I would advise you to use an 810 for about 120 seconds at 200 milliwatt on the extraction site before you start the extraction. In fact,
Okay.
if you want to give an inferior alveolar nerve block, even before you do that, you do the PBM, so that your patient will be absolutely comfortable during the anesthesia also. And after you have done the extraction, there will be no scope for any dry socket or any kind of a pain, because you will achieve hemostasis by using your 8 PBM tip on the socket, as well as the apex of the tooth which was previously there, which you have now extracted. Plus, you go back to that site where you had injected and do PBM at that particular point also for 2 minutes. You come back, change the tip. Maybe you can use a larger optical footprint wala trip, and then do the irradiation of the local lymph nodes also. You follow all these checklists, your patient will not need a single painkiller after any extraction, irrespective of how traumatic it was.
Great. Unheard of for so long.
Sir, there is evidence for
Any,
everything, sir. It's
I
rather
know, I know.
sad that
Yeah,
we somewhere it should reflect on we not being able to propagate it or project it the right way.
yes. Any Indian brand and model you suggest? Dr. Chetan Chandra, Dr. Yavagal himself is an innovator. He has created his own laser called Novolace. You can go to his website, okay, or you can connect with him on any of the social media platforms. He's there on
It's a
Facebook.
team. It's a teamwork, sir. It's wrong if I take the credit for everything. I'm just the brain behind it. But we
Yes,
have an entire team which is working for it. We have a very dynamic CEO, Dr. Sachin Manglekar. We have a very young and vibrant team, Dr. Baswant Reddy, Dr. Akshaya, Dr. Sandeep Patil, Dr. Shashank. I can't take everybody's name, but without all these people, Dr. Amruta Jhankar, without all these people, Novelace is not Novelace. So we are not sales guys. We are passionate doctors who want to spread this message across to as many people as possible, so that a lot of our patients get the ultimate benefit out of it. Dr. Ravikant Singh is here from Asian Academy of Laser Therapy. So Dr. Nashri Bhatt is there, who's also doing great work. So it's like it's a teamwork. So it would be wrong if I take the credit for everything. It's basically a teamwork, sir.
great, great. So much of positivity in your message. I hope your team goes on doing much more and many more good things in this field. Can we use this as a substitute for hypo?
No. No, sir. In fact, like I said, initial studies which were done on this particular aspect ended up charring the dentine. So your hypo is your go-to irrigant, and in the presence of the hypo, you can always use a 1 watt continuous wave 200 micron endodontic fiber, which can be bent if it's a polyamide tip, and then you can do your three-dimensional canal disinfection, or you can use a dye and do a photoactivated disinfection, or PDT. But that's not a substitute for your hypochlorite. You should be using hypochlorite as a primary irrigant, and then use this as a last step before you go ahead and obturate the tooth.
Okay, and there is a continuity to his question, so that we can eliminate hypo mishaps. As Dr.
I think
Yavagal
this is
said, we
I think
continue to
this is
use hypo, and if there is any injury because of hypo, use that laser because if this laser can take care of oral mucositis, hypo mishap is nothing in front of it.
Definitely, sir. But like I said, I think this is a pediatric dentist. I'm so used to getting these questions because we work on teeth with blunderbuss canals, open apex, and if the hypo goes beyond the apex, we are not comfortable. So I think he's a pediatric dentist who's asking this. We need to be careful in controlling the hypo. It would be wrong on my part to say that by using a laser you can completely eliminate the use of hypochlorite. So as much as I would have loved to give you that answer as a yes, it's a no.
Okay, great. Can post extraction antibiotics be avoided with lasers?
Absolutely, madam. Absolutely. Absolutely avoided, because like I said, like you have understood through this session, that all the healing systems get activated. So once that is there, the healing systems means it includes the first line of our defense. It includes the polymorphoneutrophils. It includes the lymphocytes also. All the cells that come into making the post extraction socket heal will be enhanced. So in such a scenario, we don't need any other antibiotics. In fact, if you do the PBM well, you don't even have to prescribe any painkillers.
Great. Okay, there is one question from a dentist from Mumbai. Will the company provide after sales support?
Yes, sir. We are here for that itself. That's the difference. Like a sales team may sell you something and go off, but when a few of uh, your own medical colleagues or dental colleagues come together to form a venture, their name and their brand becomes more important to them. Where are they going to go? There is no hiding for us. We are not sales guys. If we don't provide the service, then there is no hiding for us. I mean, reputed brands, the sales company pitches for something, sells it, and 2 years later they have changed the brand. We can't do that. We are professional doctors who have to stay here in this profession as long as we are alive. So there is no hiding. Our biggest forte is our post sales service, and I speak for every Indian brand. I'm not just talking about Novolace. I feel that even if, like I keep telling my team, if we lose an order, if we are not able to convince a fellow doctor, let him take any other unit that supports our economy and our country, rather than going in for any imported unit where the post sales service is a big problem. In fact, I have faced this being in this field for 17 years. 3 or 4 of my units, which are beautiful units, are stuck today because the accessories are not available. The company has shut down and we don't get the service here. The dealer who was selling those machines has vanished, or the dealers who are there are selling a different brand today. We can't blame them. They are there to do business. We are not here to do business. I'm not saying we are here to do charity, but yes, we want to do it ethically, spread the message ethically, and then make sure that the dentists of this country get the feel of what laser dentistry is all about.
Okay, okay. So there is a Novolace user here who is very happy with the post sale service by the Novolace team.
Don't take her seriously. She is my batchmate from BDS, so there is a lot of bias in that statement. But yes, she's a very good well-wisher, Dr. Deepali Dongre. She was my undergraduate batchmate. She did her fellowship later, and she has an amazing practice in Karnataka, sir. You should see the kind of cases that she treats. Her husband is an orthopedic surgeon, and all kinds of orthopedic emergencies and orthopedic challenges, the wife is able to solve it.
Amazing, amazing. Okay. So this is a question from a periodontist. What is the warranty on the machine and how affordable is the maintenance after a few years?
2 years is the standard warranty, doctor, and affordability, or rather the maintenance, if the parts are intact, then there is nothing. The company doesn't charge anything for calibration. If the user is careless, or if there is any breakage of any of the parts, then obviously it will be charged as per actuals.
Okay. What about IMDSL laser?
No, I'm nobody to comment on any brand, sir. Please don't get me to talk anything good or bad about anybody. I'm here to only promote the science and not any other brand. Let me be very honest with you. After listening to this lecture, if you go back and incorporate this technology in your center and help the patients with any other brand, I'll still be happy. So,
Great,
no
great.
comments on any brand. You are comfortable to work with any laser that you think suits your requirements.
Can it treat any oral or skin lesion without medicine?
Sir, very difficult to generalize it, but yes, most of
Yes.
the conditions it can. I showed you a slide where I requested the audience to take a screenshot of it, which has a comparison of various drugs used for various pathologies, including some of them related to the skin. So yes, but I would love to say yes, but I can't say that 100% of the times you can avoid a medicine. Majority of the times when there is a dependency on steroids, that can definitely be avoided by using this.
Great. And there is one question on tooth whitening, but I know you covered it in great detail during the lecture itself. Okay, and let us take two last questions. This is
Yes,
the
sir.
second last question. Can we have more details on the fellowship and is it online?
Okay, I have given you the details. Please write to me, doctor. I'll be more than glad to connect you to any of our fellowship coordinators. They should be able to help you out with it.
Dr. Yavgal at,
Gmail.com, sir.
okay, I am
I had
typing
put
out.
that on the last slide, sir. Can I type it somewhere? Chat with everyone in the studio.
I typed it now. I typed it from
Okay.
the central portal. It has gone on all the platforms. Okay. And what is the cost of Novolase? This is the last question. He has already answered.
Starts with 99,000 rupees, madam. Goes on up to 3.5 lakh rupees. And I don't know, I mean, we want to have a blue triple wavelength or a 4 wavelength device also. If and when we come there or reach there, with all your wishes and blessings, we will be the first Indian brand to introduce a triple wavelength machine. That's going to be in the range of around 4 lakh rupees, but it starts with a 99,000 PBM device.
Okay, let us end the session with this great positive note. On a positive note, because of this laser science taught to me by Dr. Yavgal, I am able to treat cases like trigeminal neuralgia, OSMF, leukoplakia, reduced mouth opening, and a lot more. Thank you so much. And I'm sure,
She's a very brilliant periodontist, sir. She's practicing in Delhi, and I'm so very proud about the kind of work that she's doing.
great,
So it's very heartening to see that our alumni are doing great.
great. Okay, everybody, that brings us to the end of 23rd episode. Today we had Dr. Chandrashekar Yavagal, a laserpreneur who has introduced Novolase and the science of laser in dentistry, the way he has been able to treat cases which we thought were incurable or untreatable for so long. And the kind of results we just saw, the clinical results, truly mind blowing. I wish him all the success. I wish the
Thank
entire
you, sir.
team of LaserVEDA a great success. Keep coming up with newer innovations, newer products, and make laser dentistry much more rewarding to the community as well as to you. Okay, so thank you everybody. That brings us to the end of 23rd episode. Soon we'll be announcing the 24th episode. Again, a new clinical challenge to be solved by an expert. Thank you for joining in.
Thank you, sir. It was a pleasure being here.
Thank you, Dr. Yavgal. Thank you, all the viewers who joined in, and good night.